Hi, my name is Joe Varghese. I'm a distance learning student from India pursuing my PhD in English literature at the University of Reading. My project is a critical memoir and study of chronic illness. I'm interested in creative writing, health humanities, theatre, and chronic illnesses that do not get the attention they deserve. I want to spread awareness about unfashionable chronic illnesses to encourage better environments for recovery. Thank you so much. Thank you so much for being a part of this project. You all know that health and care workers have a busy schedule, so thank you so much.
No problem. Thank you for giving me this opportunity to be a part of it. So myself, Sheena here.
So before we begin and start with the questions, I just want to introduce this project. So I created this project. It's called Acknowledging the Contributions. So recent works that are set in the contemporary time period, like the book This Is Going to Hurt, and its TV adaptation, and movies like Help, which focused on a carer's perspective during COVID-19, have tried to portray the challenges of working in the UK's health and care sector, and have also tried to represent characters who belong to the migrant and BAME community. The BAME characters usually played supporting roles in such works, but a significant part of the UK's healthcare workforce comprises migrants from around the world, including doctors, nurses, and care workers. With the UK health sector recruiting more workers from other countries during the last couple of years, this project is about celebrating and highlighting the actual contributions that they make to the UK's health and care sector, and would like to give such migrant workers, especially from the BAME communities, an opportunity to share their journey and experience of working in the UK. So my first question is, as someone who's from India, what was your migrant journey like? Uh, your unique stories based on when you migrated and your efforts to understand the UK's healthcare system.
So yes, as a migrant, moving from India to UK was both exciting as well as challenging for me. So um, it was like coming from a different healthcare system. I had to adopt not only to a new country and culture, but also had to adapt a like completely different healthcare system. That is an NHS system here. So I did my education and nursing studies in India, back India in Sant Dullabji Hospital in Jaipur, and then later on I did my practice there for 5 years, and then later on I moved to Dubai, where we had a very advanced healthcare system as well there. It was totally very big developed than India, which I got the opportunity to work there, and I really like enjoyed the work there and got the opportunity to learn the new skills and technologies there as well. But later on, as because during the recession time and also because of the my job was not so secure, like if the recession comes or something, so it's like we have to come back to India. So seeing being to see that weak point, I decided to move to London, but my a lot of my friends were working already in London and then UK, and then they told me about how they're working, how they're enjoying the work there, how they're improving their knowledge, or after developing their skills to a like higher level of role. That means like if I'm a nurse today, I can become a doctor there. That opportunity is given by the we can get in UK. So I was fascinated about that when I heard about that, and I really wanted to develop to a different role as well. So I was so fortunate at that time that different from IELTS, OET was introduced during that time. And OET was so helpful for me because all the English, whatever the test, the listening, reading, writing, everything was focused on the healthcare system. So which makes me easy to understand how, what level of test they want to do it based on my healthcare system. For example, they're asking, like during speaking, they're asking about disease condition. So when I know the disease condition, like when I'm like I have that knowledge about it. So it makes me easy to understand and say more nicely in English. So it was very helpful. It was very, very helpful for me. And in the first attempt, I got all the desired grades, which was needed to migrate to UK. So then another fortunate thing was that um, that time UK was recruiting a lot of staffs, nursing staffs that time. So it made easy that all the tickets and the charges for the tickets, visas, everything was provided by the country, the organizations. For example, I got I passed the interview for the St. George's Hospital during that time, and they are the one who issued the tickets and my visa, everything. So I didn't had to face all the challenges to get all these things. It was very easy for me to get that. And then when I came here, they are the one who um, like picked me from the airport. They provided a comfortable location to stay for um, because it was a post-COVID time. So I need to have a 10 days quarantine. So they provided a hotel for me and my colleagues. I think 10 of us were traveling to UK that time. So for 10 of us, we had a stay in hotel for 10 days. After that, they gave an accommodation in the St. George Grove. So it made us easy. Because if I come in another way, maybe I had to face the other things like, oh, I don't know the country here, so I don't know the people here. But being a part of this organization, when they came and picked me up, took to a particular location to the accommodation, it was an easy track for me. So I didn't face the challenges the other people used to have it as a beginner. So that was very fortunate for me. Other than that, then as I said, it was full of challenges as well because healthcare system in NHS is totally very high level. It is totally like based on patient safety, patient-centered care, documentation, and the emphasis is on like multidisciplinary teamwork, documentation, and infection control, and everything was based on evidence-based. So um, for this they are giving us the opportunity to learn about it. When you come here, they will not enforce us directly get into it. They will give us the opportunity to learn or like a teaching time or like the training time. I mean to say that when you are confident, then they will the NHS. I mean the NHS will give us. Uh, when we are confident, then only they will put into the patient's care, safe patient care. That means they are focusing on the patient safety, so they don't want to just put anyone without confirming or like without making sure that person is competent to attend that particular work. So for me, as I'm a theater practitioner here, so when I came here, they gave me the I should say the induction time or preceptorship course initially. So during I think initial 2-3 weeks, I was attending the classes, how to understand how the NHS is working on NHS settings and documentations, like everything is digital here, so no more like paperwork or something. So they gave me the iClip and I had a training on the computer, how we entering the patient details, how we are doing the documentation, so as to and there should not be any documentation error or something. So they made me competent in that. So they that is a very good thing I liked here. It's like I have seen my one many friends when I used to tell them come you should come to UK and work. So their first fear was that like, oh no, we don't know the settings there, and then I have a big gap in my work and all. But the good news is that though you have a very big gap, or though you are the first just and like refresher, they when you come to UK, the NHS will give you that period or the time to learn or to make to be a competent to take a particular task. So it is very welcoming to everyone then according to that. So yeah, since then I'm working in a theaters now. It's like 5 years. Initially, I was a band five, and then after gradually after learning and practicing, it made me so confident. So I became a band six, and now I'm a senior staff nurse leading a team now. So I'm much confident and happy.
Thank you so much. So my second question is, what inspired you to study a specific subject and work in the healthcare sector?
So this one I should tell that in my family, my mother and most of the aunts, they are nurses. So I have seen the nurses' life since my childhood. So I have attended my mom's clinic also, like when she used to go to work. So I have seen how the way she is working. So that made me passionate about caring for people. Then the way they used to treat my mom as if she's a god, like she saved her life or what, like in that. So it made me passionate. Oh, when we do something or we care for other people, that positive made me a positive thing in my life. So that time, this inspired me to pursue a career in healthcare, particularly in perioperative and theater practice. I will answer that because I'm not good in like the say loudly or like to talk to many people. So if we are in theater, it is like our field. So we have one-to-one with the patient, and so that thing, because of that only I pursue for the theater practice course. So I was fascinated by how teamwork, precision, and quick decision making in theaters directly impact the patient outcomes. So working in theaters gave me the opportunity to be involved in a patient surgical journey at their vulnerable lives. So I will, when I say that, when I was in 12th standard, we used to have, dissect the earthworm intestine. So I used to do it very nicely. So one of my teacher, my biology teacher used to say like, oh, you're very good in surgical, so you can become a surgeon. So though I didn't go to that level, but yeah, I'm in theaters now. So where like a patient, we are doing the surgeries. So back India, when I was working in Santokba Dullabji Hospital for 5 years, I was in cardiac and neuro theater. And then when I came to UK, I'm in ENT maxillofacial theaters surgery now. So working in theater now, I'm really enjoying my um, role. Since I said that before I was a band 5, I was working as just doing the scrubbings and all. But now being a band 6, I'm leading a team now where we have a band 6, band 5, and band 2 under me. And we have a surgical team and anesthetic team where we discuss about for the day particular surgeries, what we have planned and what we are going to do. And it's very nice to talk to the surgeons and anesthetists and doing 2, 3, if it is long surgeries, 2, 3 surgeries in a day. And at the end of the day, okay, like after having achieved that goal, going back home with a positive mind is very like helpful and positive for me.
Thank you so much for that. My third question is, how would you describe your experience of working in a developed country as someone who is from a developing country? What are some of the main differences?
So working in UK has been a valuable learning experience for me, professionally and personally. So one of the biggest difference I will say is I notice is the strong focus on patient safety, governance, accountability, standardized and standardized what should I say care pathways within the NHS. So in the UK healthcare center, there are clear protocols, structured documentations, and strict infection prevention measures that are consistently followed. And then we can see like every we have a every month we have a clinical governance. So whatever that never events or near misses happens, we are discussing there in that. So usually I used to think like that whole day is allocated for the whole nurses of that theater, where we all come together. We learn from the whatever never event or wrong happened, and what are the preventive like measures we could have taken. So uh, I used to think we are like giving that whole particular day for the particular thing. We are like there are no more surgeries in the theaters. So that is so important for us to get together and learn from our learnings. or like, okay, it never even happens. What was the mistake? What could we have done so as to improve like patient care? So that is the thing I have seen in with UK. I never seen this in India. Like we have given that particular day, because most of the people, doctors or like the management, that just focuses on surgeries, surgeries, surgeries. Like Monday to Friday, the surgeries were going on. I have never seen that giving a particular day to learn, or like nurses getting together and. Like clinic, this is what we are saying, clinical governance or the protected teaching method here. So that is a very good thing I have seen, and I will appreciate that. So another major difference is the emphasis on the like a continuous professional development here. The staffs are encouraged to attend all the learning sessions. As I said, the clinical governance, there are mass trainings. This is very, very important for us to um, like the higher level also. They check, used to check, are we competent? Is this nurse competent for higher level? So for me, it's not like this year done and then stop. No, the another year it will be checked again, and then if no, then they will not, they will ask me to do this first and then come to work. So that is the more they used to emphasis on this. So this one I would really appreciate from the NHS support and the learning and the values teamwork. In comparison to healthcare system in developing countries like India, can sometimes face challenges like such as limited resources, um, overcrowding, or the staff shortages. However, working in India, I had teach me to healthcare professional to become adaptable. I have also worked in India, so I have seen less shortage of staff, but still we are working. So that has I have learned from India. So I will that value, that base I have got it from India only. So resourceful, um, but hardworking and able to make higher patient values in India. However, in UK, everything is standardized, organized. So staff shortage is there, but still like they will not force you to work without that thing only. They will arrange some things. For example, I had a incident when one of my staff, I used when we are leading a team, there should be a band 6, band 5, and band 2. This is a particular team for a particular case. But if one of the staff is missing, I have the freedom, or like to speak out that my team is incomplete and I cannot go ahead. But I can say it can be, it cannot, it is not followed in India. In India, if it is not, you have to like proceed. However, like I have to do the band 2 job, I have to do the band 5 job, whatever. But in UK, because it affects the patient safety, I have the voice to raise that I cannot go ahead. So the management will come into it. They will come and they will help me to get in staff, to make a complete team and lead a particular list. So that is a good thing, or um, the positive thing I've seen in NHS. So one more thing is, like in India, I have seen the hierarchical process. So, so where we are like whenever the doctors come, sir, madam, or like sister, that is what. And then sometime being a junior, I know I'm a junior, so I may not speak there, because I know if doctor said that is the marking line, we can't go ahead of that. But back in UK, I have seen that every team member is same. The equality and diversity we see here. So each one has the freedom to speak out if they see any concern for the patient safety. So it's not hierarchical. It's like none is, we can't like there's no role of any seniority, or what do you say, hierarchical, this thing, like okay, their role or their seniority. So even if the junior has the um, um, power to speak up, to say everything. And then one more, I don't know if it is, I should say here, when I first came here, I used to say my senior, like sister, sister. So she said, don't call me sister. My name is Lizzie, just call me Lizzie. And she was so like senior to me. I was not able to call her by her name, but she said this is what we are following here. Even the most senior doctor, he will be very old in age and everything. We don't call him sir or like something. We call by his name, same, just putting a Mr. or something like Mr. Smith, Mr. Jairam, something like that. Even the registrars and all, here we say doctor or something, but here we just call their name. If we say something Mr. or something, they will come to us. Please don't call us Mr. It's like just call me my name. So that equality is here. It makes us all equal, and it's give me freedom to like work more freely without any fear. So that is the good thing I have seen, or the differences I have seen within the developing country and here. And then we are getting more developed. I have seen the robotic cases here now going on, which I've never seen in India. I don't know if it is there, but because 5 years ago I came here, so till that time I have never seen. But now we are doing the robotic cases. The technologies, everything is very much different here. Thyroid cases where we are using the robots for that. So patient doesn't have any incision. So everything is like to the mouth. So when the patient, after the major surgery, when it goes out, she or he is so happy that they don't have any incision or something. It's like scarless incision surgery. So I have seen that here. Other than that, also patient is being respected. Everything is consented. Like um, if patient here the rights for the patients are like more important. If the medicine or something to be given to the patient and patient says I don't want it, patient is respected, they are being like heard, and we don't force them. So this is also a good thing I have seen that. And yeah, so this is many other differences will be there. This is what I have noticed and pointed out here.
Thank you so much for that. My fourth question is, what are some of the differences that you notice as a patient based on your own experience when you compare the UK's healthcare system and the Indian healthcare system?
So say it again, the question.
What are some of the differences that you notice as a patient based on
As
your
a
own
patient.
experiences when you
Mhm.
compare the UK's healthcare system and the Indian healthcare system?
So as a patient,
Yeah,
um, as I said earlier, the main is the patient respect here, patient right, patient like everything. Patient is the main center here. So even when we do a procedure or something, we have to take a consent of the patient. Even when we are touching the patient, that much respect the patient has here. That is a big thing I have seen here. So they're not being like shouted or something. Everything said in a polite and a calm way to them. That is a good thing. And one thing I have seen here in UK, everything is like it has their common pathway. So patient, if they want have a something need to be checked in the consult healthcare, they need to go to GP first, general practitioner, and then they are going to the particular departments. Like GP will analyze what uh, um, where the patient need to go. If if maybe the patient doesn't need to go to the straight away to doctor, maybe he needs some test and something. So they will make everything ready, and then the patient will go to the this thing. But and one more thing, as I said, UK is like free of charge. Like most of the patients, they are not being charged for anything. So it makes them easy for them to go to the healthcare for their treatment and all. Back in India, when I didn't hear about any GP things. They are going straight away to the hospitals or the specialities. So has both pros and cons. Like they have to pay higher cost there, but rather than here, they are not being. So the difference between the cost and the locations are I have seen there. Other than that, as I said, technologies here is very different. The I don't know if I say it's my personal experience. Like if I go to the GPs and all for a fever, for 3 days fever, in India, back start away, they will start with the antibiotic and all. But here they will not start with that. They want to monitor like especially the kids and all. They don't start the antibiotics. And so we, as an Indian, because I had that thing, oh, 3 days fever, antibiotics. So why not they are not giving the antibiotic for my kid, and the stress is there. But later on I came to know they don't want to make the child resistance of that particular antibiotic. If it this particular fever or something is from the cold or something, can be gone by itself by paracetamol or something, then let it be. When there is no need for antibiotic, then don't give it. That is the main thinking of healthcare system here. So that things I have seen there. So the first is the free of charges for this thing. Pathway is different, and yeah, the way of treatment is also different here.
Yeah, okay, thank you so much. It's kind of good to know the both sides. I mean, it's different here, and we
I
always
didn't
talk
focus
about
on the
the issue.
negative. It's not negative from the India side, but the thing is different from which I have seen. So I don't know which one is much better.
Yeah, I mean, we usually compare with the private hospitals and the government hospitals here.
Exactly.
How we always choose, I mean, we particularly in some cases we opt to go to. I mean, it's not even a choice sometimes, right? So we go to the
Yeah,
private hospital without even thinking. So
without
there is
anything
no choice.
personally. Yeah.
There is no choice. We just go there. So like if we can afford it, that's
Yeah.
another thing. So it's good to know the other side. So
Yeah.
my last question, my fifth question is, what are some of the changes that you see in the sector with the introduction of AI? Does it affect your work?
Okay, so AI is gradually transforming healthcare in many positive ways. In theaters and perioperative care, technology and AI supported systems are helping to improve the patient safety, documents, accuracy, scheduling efficiency, and the clinical decision making. For example, the patient electronic records, digital theaters management system. For example, I should give the previous we had a on Friday we had a clinical governance mentioning about the AI settings in the theater. um, we came to know about that there will be an AI setting up which will help us to understand, or it will help us to know that when the theater is overcrowded, or that when the temperature is going down or up, even the humidity level or the ventilation levels. So before it was manual, like till now it was manual. So if we come to know, we used to see on the board, and then we have to call the estate people, and then they use then when we inform them, they will come to know, and then they will try to maintain that. But nowadays we came to know that it will like the setting is such like that before, as soon as the temperature is going down, it will be alarmed to the estate sitting very far away from us, and then they can do it before the incident happen. So it is like helpful for the infection prevention, which is a major role in theaters. So that way, the AIs are playing a very major role in that part. And other than that, it is helping to improve the diagnostic accuracy and assist with the workload management. For us, mainly with the documentation, um, and like all the recordings and all. These are being now being done by the AI now, which will be very help. I came to know which will be very helpful. Though I will say that it has not affected me working in a theater practice. So it hasn't replaced my job or something. So it is supportive to me, but not a replacement for the healthcare professionals. So as healthcare workers, it plays a most important role in ensuring the compassionate, safe, and patient-centered care.
Okay, thank you so much. That was my last question. So thank you so much for being a part of this project. And thank you so much for giving me the opportunity to meet with you. Thank you.
Thank you so much again for giving me the opportunity to speak about this. Hopefully, it should help many other people. Thank you.
Okay, bye.